Hello, my name is Stephen Lightfoot and I'm the chair of the NHS Sussex Integrated Care Board. And what I'd like to do now is just give you a very brief summary of the key outcomes from our board meeting held in public on the 26th of March in Burgess Hill. Now, we started, as we always do, with our Chief Executive's report, which provides a good overview of what's happening in the system. But this time, what Mark Smith did was to actually start with the recent government announcements about each integrated care board, which includes NHS Sussex, having to reduce its costs by 50%. Now, that's a really significant moment for us, but since the announcement was made 2 weeks ago, there's been no further guidance or direction. So obviously we're still waiting, but we will of course respond to that request when we get further direction. But on a more positive note, what we then spoke about were the system activities and achievements, and there's many to be choosing from as well. So we talked, for example, about the work of our Hospice Alliance. We talked about social prescribing, supporting people with severe mental illness. There's some really excellent work going on with cancer screening. We've had ministerial visits, and also there's been some superb public engagement events. So the system has been very active since the board last met. Now, obviously the board needs to look at its in-year performance, and we spent some time looking through our board assurance reports, particularly when it came to quality and patient experience, and also on finance and performance outcomes. And I'm pleased to say that actually of the 24 different national targets that NHS Sussex has been set, we're on track to achieve 19. So there's a real focus on the areas where we're behind plan. And they're typically things like planned care waiting lists, long waits in A&E departments, the difficulty of discharging patients back home or into a different care setting in a timely fashion, and also managing the money. So they were the areas we spent the most time on. But an area that was going really well was in the area of primary care. And we talked about real progress on our primary care access recovery plan. And it's really quite remarkable that over the last 12 months, in January to December 2024, Sussex has delivered 11.5 million GP appointments from our 156 GP practices. That's a phenomenal number of appointments, and that's 7% higher than the same period in the calendar year of 2023. So a really big thank you to all of our primary care colleagues who supported that. We then started thinking about the future, and we've been going through a major planning process for the calendar year or the financial year of 25-26. And so that we got a good update on the process that's been going through and what we've been doing to actually make our planning submission later this week. We then had an excellent report on improving lives together through research. And this is the first system-wide, Sussex-wide system strategy on research and development. Over the last year, we've developed a new Sussex Health and Care Research Partnership that involves our 3 universities, our medical school, our NHS trusts, it involves our primary care colleagues, and it also includes the National Institute of Health and Care Research organisations such as the ARC and such as the Research Delivery Network. We've got a real good infrastructure, and actually the strategy was really positive in terms of how can we use research to support our local population in Sussex. How can we improve population health? How can we reduce health inequalities? And also, how can we then make sure that we've got the best quality of care in our system? And it's also, research is really positive when it comes to thinking about how we can recruit, retain and develop high quality staff. And that actually is really the real benefit that we've got from this. The board then made a really significant decision on specialised commissioning. And we took the decision to accept the delegation of the specialised commissioning arrangements of 70 different specialist services from NHS England. And also how we're going to work with the other 6 integrated care boards in the South East region to be able to deliver that in a safe and effective way. We then went on to talk about corporate governance, because no board meeting would be complete without that. And we talked about our Audit and Risk Management Committee's report, and particularly our preparation for our annual report and accounts for the year of 24-25. We looked at our board assurance framework and mitigating the risks against our strategic delivery. And then we finished off with my chair's report and some of the other meetings and activities that I'm involved in when it comes to working with local authorities and also our universities. So there's a lot going on, and I genuinely do believe that in NHS in Sussex, we're making real progress on delivering our strategy, improving lives together. So thank you very much for your interest, and we'll see you next time. Our next meeting is going to be held on the 21st of May in Uckfield, and see you then. Thank you. Bye-bye.